see your doctor, your primary care physician, you get about 10 minutes. What's going on? Hello, I'm Dr. Schimpff, and this is a continuing series on the crisis in primary care. Last time we talked about time, the lack of time. Today I want to talk about the root cause of why there is less time. But first, the importance of time. You know, if there's not enough time, the physician is likely to say, I can't figure this out in the time we've got, so I'm going to send you to a specialist, like the story I told you last time. If there's not enough time, the physician just isn't listening. They're not taking the time to think, time for the diagnosis and the treatment that you need, certainly not time to deal with stress issues, again, like that patient last week or last time. So time is critical, but why is there so little time? Well, it has to do with our insurance system. Primary care physicians have been fairly flat reimbursements for their work for a long time, and it's much less than what specialists earn, but that's a different story. So it's fairly flat. But equally important, if not more important, is costs. Overhead costs in the office have been rising, and really quite rapidly. Well, in any business, when revenues are flat and costs are rising, you try and make it up with volume. And so the primary care physician is now seeing usually 24, maybe 30, even more patients per day. Let's use the number 24. An 8-hour day, that means 3 patients per hour. 3 per hour means 20 minutes. Well, not really, because you still have to have some time for, answering the phone, writing reports, reading reports, maybe just getting a cup of coffee for a few minutes. So it's really more like 15 minutes per visit. And when you get down to it, FaceTime, doctor to patient, is usually about 8 to 10 minutes. 8 to 10 minutes is okay for a so-called simple problem. Let's imagine I come into the doctor and say, for the last couple of days I've had this headache, and I've got a fever, I've got this rash that's sort of spreading on my chest. And oh, by the way, about a week ago I plucked a tick right from the middle of where this rash is. Well, that really sounds like Lyme disease if we're in the right area of the country. And the diagnosis is fairly straightforward, the treatment is pretty straightforward, and off you go. So 10 minutes probably works okay. But what about the patient who has stress, like that patient last time? That requires more time. It just can't do it in a few minutes. And what about the older person who maybe has some hearing or some vision or some cognitive decline? That person clearly needs more than 10 minutes. Or the patient who has multiple chronic illnesses, ones like diabetes with complications, or heart failure, or chronic lung disease. And imagine that person is probably on 5 to 7 or more prescription medications. A new problem today in that patient can't deal with it in 10 minutes. So what does happen? Patient tends to get sent off to the specialist, and hopefully they'll have enough time because I don't. So that's the issue, that's the problem. And I should emphasize that primary care physicians are well educated and well trained and like to take care of chronic illnesses. And that's where 75 to 85% of the healthcare dollar is spent today. But they don't have the time, so they don't. And that just jacks up costs and really doesn't help with quality, maybe even pushes it down some. So I mentioned we're sending people off to specialists. About a decade ago, it was 41 million referrals from primary care physicians to specialists. A decade later, it's 100 million, so more than doubling. And it's all because of this pressure of time. So that's the issue, that's the problem, and that's why we have a crisis in primary care today. Next time, I'd like to talk to you about the fact that we have a shortage of primary care physicians and why that's the case.